Before I tell you the 4 top things to remember when you're working with a client with low back pain, let me tell you a story. Recently, I had a graduate of my program call me and said, I've got a really unusual case. Can you help me with it? So we did a Zoom evaluation. I took a complete history of this client who was in a lot of back pain. Then I led him through doing all of the tests for the ligaments, the nerves, everything. And then he touched her ligaments, and they were not very painful. They were a little painful, but she had very severe pain. So it was very clear to me that that's not what it was. And I asked her to see a doctor immediately. She said, well, it takes a long time to get to it. I said, go to an emergency room because you need to see a doctor soon. One day later, I got a message from this therapist that I was working with, and he said she went to the emergency room immediately and they gave her emergency surgery. She was completely out of pain now, but that she had a really bad disc pressing on a nerve. So very important to be able to evaluate a back pain so that you know what's the right treatment. Even if it's not you, it's somebody else who's going to really help them. The majority of low back pain is coming from injury to ligaments. Most people don't know that because they feel it in the muscles. When you have a pain in your low back, it's coming either from the sacroiliac ligaments, the iliolumbar ligaments, the sacrotuberous ligament, and various ligaments on the spine. And then the pain spreads. It might spread straight across the low back. It might spread into the buttock, down the leg, even into the foot. And people feel the pain in their muscles, so they think naturally that's where it's coming from. It's always important for the client to see a physician because it might be something very serious. The top 4 things to remember is that the majority of low back pain comes from the ligaments, that there's a lot of referred pain, so it's not necessarily hurting where the pain is. People feel it in the muscles, and that's where they think it's coming from. And it's very important to have a client see a physician when the person has low back pain. The first module in our subscription service is on the low back because it's the most common injury in the whole world. Then we have 9 other modules for all the other major injuries in the body. The subscription is called Anatomy in Action. And it's called that because you have to take actions in order to find what's injured. You have to find the muscle, learn how to test it, find the ligament, learn how to test it, find the tendon, learn how to test it. All actions that lead you to understanding what's wrong and how to treat it.